This video is a presentation of the Tennessee chapter of the American Academy of Pediatrics. Funding is provided by Volunteer State Health Plan.
Behavioral health and substance abuse concerns are affecting an ever-increasing percentage of the children and youth we care for in our practices. I'm Dr. Michelle Fiskus, a pediatrician and a member of the Tennessee chapter of the American Academy of Pediatrics, and I know firsthand the challenges that pediatric healthcare providers face on a daily basis. Studies show us that 1 in 10 children have a diagnosed behavioral health disorder, and more than twice as many children have behavioral health symptoms that cause impairment. That means 1 in 5 of the children in your practice is affected by behavioral health issues. And yet statistics show us that 4 out of 5 of these children do not receive the services they need to improve their behavioral and emotional health.
My patients and their families, they're often hesitant to seek mental health services. Some families see a real stigma around those kinds of services. Families don't know exactly what kind of services are covered through their insurance. It's difficult to know, how do I document these services? How do I code for these services so that I can get paid and continue to offer them?
As convenient care clinics see more and more of the simple problems we were seeing in our offices, the population of patients we see is becoming increasingly more complicated, and many of these children have undiagnosed behavioral health issues.
Our Blue Care and TennCare Select providers see our children who are in the Medicaid system, but we also serve foster children in Tennessee. But our children who are in the child welfare system, actually 83% of them have a diagnosable mental health condition.
That's why the Tennessee chapter of the American Academy of Pediatrics has partnered with Blue Care to develop a program that will train pediatric healthcare providers to screen for, assess, and manage this population of patients. At the same time, the training provides for more efficient workflow, more effective care, and improved family and physician relationships.
This upcoming physician-led mental health behavioral training package contains some strategies that practices can use to deal with these challenges. The real goal is that physicians can partner with mental health, behavioral health resources in their community to treat the whole child. Ideally, we can be preventative in dealing with not only physical problems, but also mental health problems in a very vulnerable patient population.
In a recent Volunteer State Health Plan survey, 82% of you said you do not have a system to track behavioral health problems. Like many of us, you may be too pressed by time and system constraints. We all share in the same challenge. Four out of 5 children with behavioral health problems do not receive the services they need. We as providers need a system of care that is efficient and effective in helping us identify and manage children and youth with behavioral health concerns. The training we are offering you is a first step in that direction. By participating, you will learn how to promote a practice that integrates behavioral health services as part of each encounter. You will learn to improve identification, evaluation, and management of the most common behavioral health concerns in your practice, and develop relationships that build communication and collaboration with your behavioral health system of care.
Not all behavioral health providers are the same, so primary care providers need to know who to send this child for substance abuse treatment, this child for anxiety. We would really like them to know more about the resources that are available to them. For example, we have telephonic case management from Volunteer State Health Plan, and a child who's really complicated might benefit from having one of our case managers to encourage a child to come back to his PCP to get medications refilled for attention deficit hyperactivity disorder.
This program offers continuing medical education credits, and it's free. To find out when and where this training will be offered in your area and to register, just click on the registration information link below.
I think we as pediatric providers are in a unique position to identify behavioral health problems, to discuss these with the families, and to follow up on how treatment is going in our patient population.
I hope you'll join us in taking first steps to raise our confidence and competency in helping this vulnerable population of children and youth.
The Behaviorally Effective Healthcare and Pediatrics Training Program, BHIP, is an initiative of the Tennessee chapter of the American Academy of Pediatrics. Funding is provided by Volunteer State Health Plan.